burning to ask, but we do hopefully have some discussion time at the end. In that case, it's my pleasure to invite Ola Holmberg to the stage, and my second pleasure to be able to introduce him. Ola is one of those people who really doesn't need an introduction, but for those of you who don't know his background, he's a physicist who's worked in Ireland, in Sweden, Denmark, the Netherlands, before going to the IAEA and being a founder of, or co-founder of the radiotherapy reporting system for incidents. Ola is a major contributor to just about every international organisation in our field and was one of the secretariat who made possible the 2012 Bonn Call for Action. Ola, thank you for joining us.
Thank you so much. Okay. Thank you so much. I hope that you can hear me. And I would like to first of all thank the organizers for their kind invitation to this very important conference. So I hope to speak a little bit about the IAEA online resources in radiation protection for medical radiation technologists. And first of all, I want to put this in a context. So the IAEA is the world's central intergovernmental forum for scientific and technical cooperation in the nuclear field. At the moment now, I believe we have 175 member states. We're part of the United Nations family of organizations, and our headquarters are in Vienna in Austria. So I represent the Safety and Security Department of the IAEA. There's also colleagues in many other areas, including the human health area, which is also working with medicine and radiation uses in medicine. So within the IAEA, we have to look at all the different aspects of radiation protection and safety in all the different modalities, really. So, for example, in diagnostic radiology, which we are discussing here, and the technology advances, as you know, go very quickly. Image-guided interventional procedures. This is a modality which is expanding extremely rapidly, I would say, probably more rapidly than any other modality of radiation uses in medicine. Nuclear medicine, we have activities in radiation protection and safety, and also, of course, in the radiotherapy area. And here I just wanted to illustrate this with one of the newest modalities, the flash radiotherapy, where you can give a very, very high radiation dose in less than a fraction of a second. So you can imagine if you do something wrong in this area, it can go wrong very much and very quickly. The latest I heard now is flash proton therapy is also being looked at. So why is it so important to consider the radiation protection and safety in medicine? Well, of course, we know that radiation is extremely beneficial, but on the other hand, it may also cause harm. So we have the short-term effects, deterministic effects, and we have the stochastic effects. And if it was only beneficial, then we wouldn't have to at all consider the radiation protection and safety. But there are risks with it, so we have to consider this. Another reason why we have to look carefully at radiation protection and safety in medicine is that it's such a huge activity all around the world. According to the United Nations Scientific Committee on the Effects of Atomic Radiation, they publish an estimate of the number of procedures about once every 10 years or so, and the latest numbers were published just a few months ago. According to these numbers, there are now 2.6 billion conventional radiology procedures annually, plus 1.1 billion dental, 400 million CT, and 24 million interventional procedures every year around the world. And you can also see the numbers for other modalities here. So we're talking about more than 10 million procedures per day around the year. And this also makes it very important to consider carefully the radiation protection. Another reason why we need to consider radiation protection in medicine is that there are so many unnecessary imaging procedures performed. And according to some estimates and surveys, around 20 to 40% of imaging procedures may be unnecessary. So they're not considered as being justified, and they may add more risk than potential benefit to the patients. And we're hearing more about this justification issue in this session. So in essence, they're contributing dose and risk to the patient, but they're not contributing sufficient potential benefit. I've illustrated this with the ACR appropriateness criteria, which is something you can use, of course, to strengthen justification. So justification, but also optimization. So there's another issue here in radiation protection. The level of image quality should be sufficient for diagnosis, neither more nor less, and much imaging is not optimized, so it's giving a higher dose than necessary. In other words, it's contributing dose and risk to the patient unnecessarily. And in addition to justification and optimization issues, there are also unintended exposures in this area. So these are all radiation protection and safety issues. So the question is, what do we do at the IAEA to address these issues? Okay, so we do many things, and I'm just going to give you a few examples of that, and especially what do we do online that you have access to as medical radiation technologists. So I'm going to go straight to that. And one thing that we have available for everyone for free is the e-learning packages. These were launched at the end of 2016, and we have now had more than 12,000 users to date in these. You can see that there are a number of e-learning packages that could be of interest to you. For example, in addition to these, we also have DRL introduction and many other packages. So once you go through this, you can get a certificate of completion if you manage to do the test at the end of the e-learning course. You find all our resources on the Radiation Protection of Patients website, which annually has more than 1 million page views. And if you remember one thing from this talk, I would urge you to remember the acronym RPOP, because if you put in RPOP in Google, it will take you on the very first hit to the Radiation Protection of Patients website. This is where you find all the free material that is made available. You can also sign up for our newsletter, which is sent out to more than 10,000 people around 10 times per year, with a lot of news in this area. We also have webinars for several different categories of health professionals, including yours. At the moment now we have more than 70 online lectures recorded, so I'm sure you will find some topic of interest to you. There's been more than 15,000 people registered here. We have videos available which you can look at, 5 videos for both health professionals and for the general public and patients. One of these videos managed to attract more than 100,000 views in the first weekend, the video on safe medical imaging for children. There's also free material to download here. Here you have an example of a poster that can be downloaded to be put in the waiting room of patients, reminding patients that they should tell the staff if they are pregnant or if they think they may be pregnant. There's example here in both English and in Arabic. And finally, the Bonn Call for Action implementation toolkit is something we introduced recently. This is a toolbox which is pointing to different tools, not only developed by the IAEA, but also by many other international organizations or professional bodies, which may be e-learning packages by other organizations or other types of recorded tools of guidance material. We have now more than 1,000 freely available resources for health professionals. So just as an example here to round off, if you filter here on radiology for medical radiation technologists and material in English, there will be more than 200 tools, which includes e-learning packages, recorded webinars, guidance materials, fact sheets, posters, and videos. So a lot of this here. The very final slide, I believe, is just a reminder or an information that, as Steve kindly mentioned, back in 2012, we created the Bonn Call for Action at the International Conference in Bonn. We had an update, an interim conference in 2017 in Vienna, and now it's time again. In 2025 will be the next international conference on radiation protection in medicine. This time it will have the subtitle X-ray Vision. So I hope that you will have an opportunity to come to Vienna just before Christmas in 2025. Thank you very much.
Thank you very much. Our next speaker is Michael Karua.